Thank you very much. Hello and welcome everybody. It's absolutely delightful to see all your names, but sort of know that you're there. My name is Stephanie Best and I'm a Senior Research Fellow with Macquarie University, but I'm based down with Australian Genomics at the Murdoch Children's Research Institute. So I'm going to be talking about, let me share my screen so you can see what I'm going to be talking about. So I'm going to be talking about implementation research, and I work in the field of genomics. So a lot of my examples are going to be sort of referring to genomics. And when I talk about implementation research, what I'm talking about here is looking at the kind of stuff that we kind of know we should be doing and how we go about getting that into practice. So let's crack on, and hopefully we'll have a little bit of time at the end if there are questions that people want to be asking. So the first question really here is why, when we know we should be doing something, do we not actually just crack on and do it? And this can be from, I seem to move my slides along. Oh, there we go. This can be from anything from getting the exercise that we need, could be doing some academic work, it could be doing schoolwork, it could be doing work, could be anything along those sorts of lines, could be our diet and what it is that we know we should or shouldn't be eating. And the same question can also be applied when we're considering clinical interventions, when we talk about what's happening in healthcare. Now, there are loads of behavioural models, or there's quite a few behavioural models. And this one here that I'm just putting up, is I quite like this one. It's quite a nice way of explaining our behaviour. And so this is the COM-B model. And the COM-B model talks about capability, opportunity, and motivation, and argues that it's these three factors that feed into how we choose to behave. So when we're talking about capability, it's kind of like, we can do it. When we're talking about opportunity, is it actually possible to do something? Do we have the resources to do it? Can we actually do it? And then motivation is kind of like, do we actually want to be doing something? And it's quite important that we understand these factors that lie behind our behaviour, because if we can understand these, then it influences how we might want to go about interacting and changing people's behaviour. If we don't understand what's underlying, then we can't even start thinking about how we're going to change behaviour. So when we think about this yes, this question here, why do we actually need to know about this? Well, when we think about it in a healthcare setting, which is the work that I'm interested in, the area that I work in, if we don't understand why people do or don't do things, and if we don't understand what's lying behind it, then we can waste a phenomenal amount of resources putting in inappropriate interventions to support people to be doing what it is that we want to do. So typically, if people aren't doing stuff, we develop some sort of education intervention and we say, we just need to get them more training and that will be the thing that decides it. But you already know from that COM-B model that actually if the problem is around motivation, if people don't really want to do it, giving people more education isn't going to be the thing that's going to help. So we want to be looking at this from a healthcare perspective, because we want to be able to facilitate the speed at which those evidence-based clinical interventions that are out there, how we get those into practice. So I've got a slide here that talks about the discovery aspect of health research, and you can see sort of on this left-hand side, we talk about discovery. And we have lots of funding that goes into that part of our that part of the healthcare system. Then there's also some funding that goes into looking at clinical practice. But where there's a dearth is this bit in the middle here. We kind of seem to just assume that a little bit of magic is going to happen, and we're going to whoosh from discovery and get things into clinical practice. And so you can see here, I think we should be a little more explicit in step 2. And this is the area that implementation research is interested in. So one of the definitions here is the scientific study of how to promote the use of proven treatments, so stuff that we've got evidence for, how we get those into routine care, and our overall objective is clearly to be improving health. So today what I want to do is talk a little bit about implementation research, and as I've said, that focus for me is very much in the healthcare system. I want to talk about consumer engagement because I think that's really quite key. And I'm going to give you an example of some work that I've done around the project that we've called the COVID-19 Journals Project. So starting off, first things first is when we go into looking at how healthcare works and what it is that we're going to be doing, we can have these great expectations. And this image here on the left-hand side is me at the beginning of lockdowns and pandemics thinking, this is how my daily yoga practice is actually going to look. And it's very poised and controlled, and we all know what's happening. The reality is more this image over on the right-hand side here of things maybe not quite going to plan and other things coming into play that we need to consider that we haven't really considered. And if we take this analogy into the healthcare system, we can think that healthcare works like this image here. It's nice and structured, it's very rational, there's decisions that are made at the top and they get filtered down, and this is how it works. The reality of how healthcare works is more this image on the right-hand side here. So this is the interaction of different people. This is within an A&E department, and it hasn't got that smooth, structured organisation that you saw and you can see on the left-hand side. So we call healthcare is a complex system, it's a complex adaptive system. And you can see from that image and from the experiences that you will all have, we cannot change the healthcare system by just asking it or telling it, demanding, just sort of getting on our standing on our box and going, you must change. That is not going to help a complex system like this to be changing. So I mentioned right at the beginning, the area that I work in is genomics. And genomics is a highly, highly complex environment. So this is just what we call a rich picture of the work that goes on in genomics. And you can see some of the interactions that go on between different people, different groups. They will all have different focuses and different areas that they will be concentrating on. So we need to have a more sort of holistic approach as to how we're going to be looking at implementation of genomics. So clearly my sort of key message is this idea is it doesn't just happen. There are some people who talk about building a better mousetrap and the world will beat a path to your door, but the reality of it is it doesn't work like that. And this idea here of this young girl here, hope is not a plan. We can't just have some evidence-based practice and then just hope we're going to get it into routine clinical practice. So the next area that I want to be talking around is why do we want to engage consumers in research? Why should we engage consumers in research? This is a bit of a rhetorical question to you in this setting. But these are some of the reasons why it's important for us to be considering engaging consumers in research. We get increased relevance of the research that we're actually doing, and it starts meeting the needs of our population. We get greater accountability, improved quality and outcomes. We can have decreased costs because we're not wasting our time doing stuff that people don't want us to do. The translation of evidence into practice can be more effective. And also by engaging people and being more transparent about what it is that we're doing, we can get improved public confidence in research, which is really quite critical. But we also need to be mindful that, of course, there are barriers, there are challenges to engaging consumers in research, and it would be naive not to be considering some of these. So for researchers, that can be around the fact that it does take more time to involve a wider group of people in the research that we're doing, and with that will come increased costs. But for consumers, it can be challenging because you won't necessarily have the training available. It depends whether there's supervision and whether there's support to help bring people through the research process. And so many of you may have seen this conceptualization of consumer engagement. And this is something that was from somebody called Rnstein back in the 1960s, a long time ago. And this model has changed, but I quite like the way it sort of sets it out. It's quite easy to sort of get a grip of. And so Rnstein argued that there were various levels of consumer engagement, going from at the bottom this idea of coercion and education. And this is around sort of non-participation. This is more about doing unto people. The next step up is more about, Rnstein argues, around tokenism, doing for people. And then as we get up to the top of this ladder, then we're talking more about citizen power. And we're actually getting to the stage where we're doing with people. So we've got researchers and consumers working together to set the agenda and to be delivering the research together. Hold on a second, I've just lost my mouse. Oh, there we go. This is another way of looking at consumer engagement I quite like, because it talks about there being a spectrum of public participation. And it splits at the top and the bottom here. At the bottom, we've got what is the promise that we're going to be making to the public. And so here it's actually being transparent about what it is that we're going to be offering, how it's actually going to work, because it might not be appropriate to have full-on consumer participation with every piece of research that's going on. So what is it that we're actually saying that we're going to be doing and how we're going to be engaged? And at the top of this table here, you can see what is the public participation goal. So we go from the left-hand side where we've got informing, and we talk about keeping people informed and having that balance between providing the public with balanced and objective information and helping people to understand what's actually going on. And then all the way through, and I won't go through each of these, all the way through to empowering people. So you can see the promise to the public is about we're going to implement what it is that you decide. And at the top here, we think about what is the actual goal of this. And this is to actually place the final decision-making process into the hands of the public. So when we're doing a research project, we might want to be thinking along these sorts of levels, what's going to be sort of appropriate, how do consumers and how do researchers, how they're going to best work together for each project that we're tackling. And there's just a couple of references here and some groups that you may well be familiar with. James Lind Alliance from back in the UK do some excellent work with consumer involved in health research. We've given you a reference there for a group in the States and also in Canada. And I just thought I'd just pop in this book here, this Beyond Sticky Notes book that I found really helpful when working with consumers. Keep an eye on my time. So what I want to talk now is, or what I'd like to take you through is a project that was a co-conceived project with researchers with Australian Genomics and consumers and consumer advocacy groups through the GSNV, through the Genetic Support Network Victoria. So the idea behind this project came about as a joint conception of an idea over a cup of coffee, which is, you know, sort of such a fantastic way of initiating some of these projects. And then it was a joint delivery of all the ethics processes, the data collection, the analysis, and the subsequent paper that was published as a result of this. So the COVID-19 Journals project was a project that we ran in the first year of the pandemic. And what we wanted to do was to investigate how we knew that things were changing really quickly for people through the pandemic. All the what we could and couldn't do was changing, the information was changing. So what we wanted to do is investigate how that was impacting on the lives of people with a genetic undiagnosed or rare disease, or people who were part of that community. And we gave ourselves a couple of wide-reaching objectives to see what the impact was on the well-being and resilience of people in the GARD community. We wanted to see how it affected their access to health and social care services. And really importantly, what could we learn from doing this project that could be used for future health and social care service provision? So what did we do? What we did was we asked adults with a genetic undiagnosed or a rare disease to take part in the study, and that included carers or people who were part of a GARD support group. And we asked them to keep a diary over the year and submit what they were happy to submit to us sort of once a month. And people could write what they wanted, they could draw, they could send photos, they could send videos. It was fantastic. We've got a whole range of different ways of collecting diaries that were sent to us. And when we looked at the diaries, we were thinking one of the key things I said to those objectives, one of the key things we were looking at was around resilience, amongst other things. So what did we find? We were lucky that we had people participate from a lot of the major states in Australia. And we generally got about 10 journals each month, which we were quite pleased about. So I said to you that one of the ways we looked at this data was using a resilience framework. And so what I've got up here is a slide that has got a resilience framework, and that the details of that are down the left-hand side. So we've got things like perception of self, social competence, structured style, all those kinds of things. Then the next column down gives you a descriptor of what that actually means, sort of what does a perception of self actually mean in real life. So the descriptor that they give for this particular framework is, I know if I continue, I will succeed. Yeah. And then over on the right-hand side, further across, here are some of the examples of sections from journals that we have coded to these different areas. So you can see here that if we stick on the perception of self, I will have to attend classes virtually instead of returning to school. And despite being isolated, I found some things to do to keep me busy at home. And then the social competence one is around, I can establish friendly relationships. So I've made new friends while attending the first course, and I've met new people through a new support group. And I won't go through all of them, but this is basically the process that we undertook. There were some additional codes that really sort of jumped out at us when we were reading through and going through all the journals. One was around different turning points for people, particularly for them sort of either because of the pandemic or because of accessing support or because of accessing services. So, for example, there were people who talked about getting new GPs and new neurologists, talking about things like the lifting of restrictions, and the impact of sort of no support workers. And we also had another code that we put in that was particularly around coping strategies. So we talked about general coping strategies. A lot of these were, they were relevant to the pandemic, but actually they were relevant far, far broader than that. So one person here is talking about writing has helped me cope with everything that's going on, and playing a guitar helps calm me down. So various different coping strategies, and just some examples here. So when we looked at all of these findings overall, what we found really is that there were waves of support that would have been helpful for the genetic and undiagnosed and rare disease community. The first wave really related to finding a framework that would help people structure their day-to-day life. The pandemic came in and it just took away all of the structures for people, and it just really threw people out of kilter. And actually, if we looked at providing some framework and helped people structure their days, we didn't need to tell people how to structure their days. But if we offered people guidance as to how they could do that, then that might be of help. The second wave that came in a little bit later was just this idea of consistency of communication of health information. Now, that wasn't the health information shouldn't change, because obviously as our knowledge has changed through the pandemic, it is going to change. But it's consistency in the messaging. And oftentimes this was to do with who was giving us the message. And then the third wave of that came into us, that came in after these other two factors, was around support for mental well-being. And this went for whether it was people with a genetic undiagnosed or rare disease, or whether it was another member of the community. It didn't matter, young or old, providing support for people with their mental well-being came through quite strongly. So, in conclusion, what I've spoken about for the last sort of 20-odd minutes really has been about the role of implementation science and research. Talked about what I think is important, that we have consumer engagement in the work that we're doing. And it's given you an example of the COVID-19 journals as a way that we can be bringing together researchers and academia and consumers and patients and the wider community, bringing them together to be delivering a project. So thank you very much for listening. More than happy to take questions. I just want to point out that if you've got any other queries or about today, then I have my email address at the beginning, happy to talk to people. But there's the CP Achieve email address there, and you can see that the CP Achieve link for Instagram, Twitter, and Facebook is there as well. And also important for us to note that the CP Achieve is funded through the NHMRC, and they've got their own websites there. So if I stop sharing at that point,